There are many criteria that you can use to measure palliative care programs, and probably one of the most important ones is patient satisfaction, and that includes things such as how their care is managed in regard to symptoms, which could be nausea, vomiting, could be pain, could be confusion. It can be overall satisfaction with the experience that they had with the care team. We look at demographic measures, for example, who it is that we're treating, what kinds of syndromes they're having, are they getting palliative care consults early or later. As I mentioned with the prior question, it's very important, I believe, if we're going to have any impact on a patient and their life and their treatment scheme, we should be involved early. So we can measure, once we were involved, what impact we had and what kind of satisfaction we had. Were we able to get the patient out of the hospital with better symptom management at an earlier period of time than they might have had they not had a palliative care consult? That's very important. We can also measure how effective we are with the use of resources. Are patients getting things done that they shouldn't and might be causing more of a burden than good? Are we addressing their value systems? Are we addressing the fact that they have advanced directives? Are we addressing their do not resuscitation status, which is extremely important to people but very poorly addressed, generally speaking? Are we getting consults from our colleagues, and who are they? One of the measures that we're putting into the hospital right now to hardwire our system is putting criteria together, such as whether or not somebody has poor symptom control, whether or not somebody has advanced disease, so we can measure, for example, is it end-stage renal, is it cancer, is it congestive heart failure, is it multiple myeloma or multiple sclerosis, and have they seen the palliative care program or physicians before in the past, and then suggest to our colleagues that they be considered for a palliative care consult. And then measure whether or not colleagues are saying yes or no based on criteria which suggests that the patient could benefit from palliative care. I can go on and on. There are lots of different things that you can measure, but that's a good, I think, example.